Hello, I'm Tatjana from Macedonia, and I'm really glad that we are taking part in this conference, me and my colleague Kristijan, and today we are going to present one case report about patients with autoimmune hepatitis which had really positive results with immunotherapy. Autoimmune hepatitis is a chronic disease of unknown case characterized by continuing hepatocellular inflammation and necrosis, which tends to progress to cirrhosis. Immune serum markers are often present, and the disease is often associated with other autoimmune diseases. The prevalence of autoimmune hepatitis in Europe is estimated as being in the range of 10 to 17 cases per 100 persons, 1,000 persons. It is most common in those aged between 10 and 30 years and in those between 40 and 50 years, but can occur at any age. This disease accounts for about 3% of liver transplantations in Europe. Women are affected 3 to 4 times more often than men. In our case, the patient is man. Signs and tests. What test patients should do to estimate the diagnosis of autoimmune hepatitis. We can see that in this disease there is abnormal liver function test, and liver biopsy is showing chronic hepatitis. And other test for autoimmune hepatitis is anti-liver kidney microsome type 1 antibody, anti-nuclear antibody, and anti-smooth muscle antibody. Without treatment, nearly 50% of patients with severe autoimmune hepatitis die in approximately 5 years. Because it's making this disease very serious, and outlook for treated patients with this disease is generally very good. Within 1 year of stopping treatment following histological and biochemical remission, 50 to 90% of patients have a disease relapse. Cirrhosis develops in 30 to 50% of patients. What is the objective of this study? We want to show the positive effect of immunotherapy applied within 6 months of a patient suffering from autoimmune hepatitis through monitoring of multi-parameters. In our case report, in September 2011, the patient was hospitalized with intense coloring of the skin and laboratory biochemical analysis in addition to acute hepatitis. In the tests, viral hepatitis was excluded. Followed regression of the coloring and gradual improvement of the laboratory chemical analysis. He left the hospital with coloring without subjective complaints. In March 2012, the patient was again with intense staining of the skin and visible mucosa. Following tests were made. Biopsy, which proved that there is inflammation with dominant monocellular cell infiltration, necrosis. Anti-nuclear antibody was with positive result, and abdominal ultrasonographic imaging showed minimum hepatomegaly, peripancreatic lymphatic noda with size 10 on one side and 23 millimeters on the other. Serum protein electrophoresis showed gamma globulin increased, and increased values of ALP, aspartate aminotransferase, glutamine transferase, alanine aminotransferase, iron, and iron binding capacity. And as was established diagnosis of autoimmune hepatitis. By measuring electropunctural points by the method of Paul, following results were obtained. We can see that on some points there are very increased values, and on some points the function of those organs is not very well and show to chronic disease. Uric testing of infection agents, we found the presence of hepatitis A and hepatitis C viruses, and this patient was treated with 5 immunotherapies over 6 months, and his condition was monitored through measurement of electropunctural points by FOL and through biochemical laboratory. enzymes ALT, AST and GGT. When the first time hepatitis occurred in this patient, reduction of coloring of the skin and visual mucosa started after 1 month, and complete withdrawal of the coloring was observed after 2 months and 15 days. We can see the big difference of the results without informatherapy and with informatherapy, when in the same patient all coloring pool in just 10 days with informatherapy. And AST for those 6 months was back to normal and started from values more than 250, and then just went back to normal with informatherapy. That means to the values less than 37 units. Laboratory definitely confirms the good health of the patient. The same is with ALT. From the values more than 900, they decreased to a normal range, that means less than 41 units. And GGT, with values more than 90, they decreased to normal values less than 50. Electropunctural diagnostic card by Fold had also very good insight into improving the overall picture of the patient, and is the best proof that this patient is now feeling very good. And we can see what happened in those 6 months. As a conclusion, we can see that, and we can conclude that informatherapy led to substantial improvements in patients suffering from autoimmune hepatitis, followed by symptomatic disorders and biochemical parameters. Thank you for your time.